Another area of interest for a lot of migraine sufferers is alternative therapies and complementary therapies. Is there anything in the evidence to support the use of this?
Oh, yeah. So there are devices actually out there. One of them is this this device called a trigeminal nerve stimulator. So the trigeminal nerve, we both know, is the fifth cranial nerve, and it has it's trigeminal, so three, and the top branch comes out right about here. And it you put this device on your head and push the button, and it actually stimulates that nerve. And that is called a cephaly. And I've given that to patients. They've actually feel like it helps from an abortive standpoint and from a preventative standpoint, using it every day at night before they go to bed, and then using it when they get the headache. They'll take their abortive medicine, put this thing on their head, push the button, and kind of sit in a dark room and try and get the headache to go away. There's vagal nerve stimulators. There's these things that are like TENS units that you put on your ears. So a lot of those preventative devices we give to patients who are a little bit leery of taking prescription medications, but the evidence that they have to work, they actually work pretty well for the right patient.
What about acupuncture?
Oh gosh, so yes, acupuncture, we do send patients for acupuncture. And they feel like they usually go more on a biweekly type basis to keep their migraines in check. So it's more of a long-term preventative type thing versus an abortive. So yeah, so acupuncture does have a role. And we do have some patients who get really good results from that too.
Anything else in terms of like yoga, meditation, things like that? Anything else that you would recommend to these patients?
So lifestyle changes are huge. Understanding your triggers is one thing that I try to get my patients to do, to understand if certain foods trigger, if certain types of weather triggers your headaches, if smells, preservatives. Like some of my patients, I get them off of preservatives and their headaches get better. Other things, exercise. Exercise just has tons of benefits all around, but doing regular exercise, improving, not only helps decrease the headaches, but it improves your sleep. And then sleep itself can help with treating those migraines or preventing those migraines from happening, getting a good amount of sleep. Yeah, so for some patients, you need to think about really all these different types of approaches that you might want to look at, from more of a holistic look at your whole life, your lifestyle. And most doctors will give you certain ways to improve that to try and decrease your risk of developing more and more migraines.
And Dr. Hatchett, where can people find you on social media if they want to learn more about you?
Sure. So I am on Instagram. I'm under Dr. Kim Neurodoc. You can also find me on my website, drkimberlyjhatchett.com. And I have a newsletter called The Bluff. It stands for the bottom line up front. And there's links on Instagram and on my website to sign up for the newsletter.